Welcome to Lesson 4 of Module 213, Physical Disabilities and Personal Care. In this video, we'll focus on strokes and on post-stroke symptoms and syndrome and how to help people. There are really two types of stroke, and a stroke is really just an event that interrupts blood flow in the brain. The most common is called an ischemic stroke, meaning basically a blockage in the blood vessels of the brain, and the area downstream of that blockage doesn't get enough oxygen and the tissue starts to die. And that blockage is usually referred to as an embolism. So if you hear that term, it often refers to a blood clot, a buildup of plaque, the same kind of stuff that causes heart attacks, or as I mentioned earlier, even a bubble of nitrogen from a person who surfaces too quickly when scuba diving. All of them could form that embolism. Another type of stroke is called a hemorrhagic stroke. And you remember we learned the word hemorrhage earlier and said that it referred to bleeding, especially internal bleeding. So this type of stroke is caused by exactly that, a bleed into the brain. The area where the bleeding occurs is called an aneurysm. The aneurysm represents both the bleed or an area in a blood vessel that has weakened, and that weakening might even cause a bulge. Sometimes the fluid in the blood seeps out through the weakened area, or the bulge itself pushes on other blood vessels. But by far the more common thing is when the blood vessel itself just breaks and starts to bleed. This type of stroke on the left is the more common one. And the good news is that with the right medicines, they can often do something to reverse these effects, especially if you get help early. It's really important to understand that this left-hand side type of stroke can come and go for the first one or two times that it occurs, and that's given a special name called a transient ischemic attack, or TIA. It's a mini stroke. The clot gets in the way, there's a blockage, but after a few moments, maybe minutes, it floats away and the person returns to normal. Really important to see that as a warning sign and get the person medical care, because that is likely to happen again if they don't get that care, and it may not be transient the next time. It may permanently damage their brain. So the stroke first aid, you probably remember from your first aid course. It's very important. You'll probably see commercials about this. And the first three letters of FAST are mnemonics for the symptoms you're most likely to observe. The person's face may droop, they may have difficulty smiling, their arm may seem to be weak or even paralyzed, and they will have a different speech. Most commonly, they sound like they have slurred speech. It's been perceived in some cases by law enforcement that people are drunk when they're not. They may not have an ability to find the word or even speak at all. So speech difficulties may also be a symptom. And the T stands for how fast we must respond. So calling 911 and getting help promptly is the difference between a person recovering or not recovering. So strokes can be fatal. It's quite common for that to happen. But with early intervention, people can actually get back to normal in many cases. And I actually know people, multiple people, who have had that earlier intervention and they have gone back to being healthy and functioning just hours later. So there's quite a difference if we intervene quickly. So what other first aid is there besides calling 911? Well, I have to remember that a stroke, especially if it's an aneurysm, will gradually cause the person's symptoms to worsen. So we have to monitor their ABCs, their airway, breathing, and circulation. We do this by simply watching them, checking their responsiveness, checking the color of their skin, and using our ability to take a pulse if we've been trained in that. If the person shows signs that they have stopped breathing, or even worse, if their heart stops beating, we should do rescue breathing or compressions in rescue breathing and CPR. Sometimes you may not feel it's safe to do the rescue breathing, but you can do compressions only CPR. We would also want to treat the person for shock, even if they're still quite conscious. And you'll remember that the mnemonic for shock treatment is WAR, warmth, air, and rest. Cover the person with a blanket because their circulation has been slowed by this whole thing, and the blood flow is what keeps people warm. Help them with air, open a window, or give them oxygen if that's available in their environment, and help them to rest, especially if you can help them to lay down. And you want to lay them down on the side that is not affected. If they have a paralyzed arm or face, put that side up. and make sure that the person is resting in a way that if they were to have worsening symptoms, they don't roll over and fall. Don't give the person any medications or food, and make sure that you understand how to do the secondary survey, which includes things like recording the person's symptoms, finding out their medical history or whether they have any allergies, taking their pulse, making sure seeing what their last meal was, and finding out if any events have occurred leading up to it, such as whether they had a fall or whether or not they might have been exposed to something that was toxic. And you want to record all of that and record the date and time that you took those things. You take the pulse repeatedly through the time while you're waiting for 911 to arrive. And there's been multiple times when I've done that and been told by the EMTs that that made a big difference in the health care for the person at the other end and may have in fact saved some people's lives. Something as simple as keeping a record that you can hand to those people will make a big difference. So after a person has a stroke or post-stroke, they may have some lasting symptoms, and these can cause physical disability. Those symptoms might look like this: weakness in parts of the body, including specifically certain limbs, or it may even look like paralysis. They may have limited mobility, especially on one side of the body, as we said, as in hemiplegia. They may feel joint pain or rigidity. Rigidity means that the person is no longer able to flex or bend in an area. They may have spasticity that we talked about quite a bit earlier, where a muscle will tighten and not release. They may feel pain in parts of their body. They may have a change in sensation, so they may actually have less ability to feel things and experience numbness. 3 important vocabulary words that you may remember from previous modules: apraxia. So whenever we see "a" in front of a Latin word like this, it should tell us that something is not happening. And so when a person is apraxic, they have difficulty getting their movement started or being coordinated. They may have specific ways of walking, or they may not be able to do things like get up out of a chair or out of their bed. Dys refers to, whenever we see the letters DYS in front of something, it refers to a person having dysfunction. They may not be unable to do this, but they may have difficulty. Dysphagia, with a G, is difficulty swallowing. And aphasia is difficulty speaking. So you can see that at least a couple of these symptoms are very similar to the symptoms you might have seen during the stroke itself. The person may also have emotional symptoms. They could be primary or secondary. If their brain has been damaged by a lack of oxygen, it can affect the emotion center. Or a person may simply have secondary emotional effects because they've lost a part of their ability, and that's awfully difficult for people. So they may experience symptoms of anxiety or depression. The person may also become incontinent, another vocabulary word you should make note of. Incontinence simply means that a person has lost control over their elimination functions. And you remember that elimination is the ability to go to the bathroom on our own. So you can have bladder incontinence, meaning that you pee yourself, or bowel incontinence, meaning that you soil yourself. You may also have impaired or loss of vision if the nerve area that was affected by, or the brain area that was affected by the stroke was your vision center. Or the person may simply have difference in their visual or auditory perception. They may have ringing in their ears or spots in their eyes. It's just a couple of examples. And often people may have problems with their memory. Curiously, some people will lose their long-term memory but keep their short-term. Or they may have the opposite. They may be able to remember things that are very far in their past but not remember things from a few minutes ago. And they may have difficulty with certain types of thinking, like linguistic thinking, understanding how to write, or understanding how to do mathematical thinking or problem solving, depending on the parts of the brain that were affected by the stroke. What happens to a person depends a great deal on the level of the symptoms that the person, what we do to help them depends on the level of symptoms and the expected degree of neuroplasticity. Neuroplasticity is the ability of the brain to basically fix itself. An interesting thing about the brain is that it does not regrow the brain cells that are damaged. But what it can do, very curiously, is build new pathways. So if, for example, you can imagine that a bridge across a river was destroyed by an explosion or an earthquake, Rather than rebuilding the bridge, what the brain will do is build a whole new bridge. And that's sometimes quite an incredible process that can take quite a lot of time and rehabilitation. People who are younger tend to have better results in their neuroplasticity, and people who are already in good shape and don't have other health conditions, like for example, if they don't have diabetes or if they don't have risk factors like being a smoker, their body will do better in terms of rehabilitation. Rehabilitation is our first choice for people, and we usually do as much, we get them as far as we can before we start looking at using environmental and equipment adaptations to make up for what they can no longer do. In a previous video, I asked you to look up what GF Strong was, and hopefully you came to understand that GF Strong is a rehabilitation facility here in the Vancouver area, and it is not only really respected in our community but worldwide for the really progressive work and research that they're doing there to make sure that we really advance what we know about people with brain and spinal cord injuries. And you may know the story, of course, of Rick Hansen, one of the most famous of British Columbians. And Rick Hansen's Man in Motion tour around the world in his wheelchair helped to really fund a lot of spinal and brain recovery research here in British Columbia. So we're actually quite ahead of the game compared to a lot of other places. After people have had a stroke or any kind of brain injury, not only can they become weakened or paralyzed, but as we've said, they can lose sensation. What we haven't talked about is why that can really matter in terms of people avoiding injury in the future. We don't really think of pain as a good thing, but one of the important things about pain and also the ability to sense temperature is that when we put our hand into a spot that hurts or we are feeling some pain, we'll move away that extremity. When people have lost sensation, they don't do that. So it becomes more important for us as the care worker to monitor and make sure that we're seeing that. I've seen, for example, people put a hand of an injured person on a wheelchair rail and then push that person close to the wall and have their finger be really squeezed between the wall and the wheelchair, but the patient didn't know. The injury can still occur even though the person doesn't feel it. So it becomes up to us to really carefully monitor things like how a person is positioned in a chair. Again, things like bed sores and ulcers can really be an important thing to avoid by having people move. And we also have to think about the ability to keep people's circulation on the area that's been weakened by the stroke, because that weakening also affects their blood flow or circulation on that afflicted side. So rotating people and doing their occupational therapy routines can help to maintain good blood flow and their overall physiological health. Whatever the person's individual needs are likely to be very different from one person to the next, and so will their care plan. It'll usually be individualized based on the person's current health, their age, and exactly what their symptoms are, and it'll likely be created by their doctor and other healthcare professionals, including people like occupational therapists, nutritionists, and community health nurses. So you'll be asked to help execute. You'll often be the executive arm or actor that helps that care plan to work, and also to give feedback to those professionals about what's working and what's not. One of the most important things is for people to avoid the risk factors that led to their stroke in the first place. Those could be lifestyle things like smoking or a poor diet or inactivity. And they can also be the management of chronic conditions such as hypertension or obesity by taking medicines or by following a specific caloric reduction diet. But it's really also important, and sometimes this is a difficult conversation to have with professionals in the medical community, that we respect people's dignity of risk in the exact same way as we would expect. Because strokes are often associated with people who are older, and of course, when we're older, we have established a lifestyle that we often think of as working for us, and it becomes sometimes more difficult to change. So while we want to educate people and give them healthy opportunities to avoid risk factors and live a healthier lifestyle, we also want to make sure we don't force or demand of people that they live with those risk factors or that they accept all parts of their care plan. They need to be advocates for themselves, and if we do try to force or demand, typically what we end up with is a person who becomes even more entrenched in the unhealthy habits that caused them to have their stroke in the first place.